I personally feel that COVID, if all of us remain together and if we have the right, I think that the country has the right approach. COVID is already on its way out.
India is reeling under a severe second wave of the coronavirus amid growing concerns over the new double mutant variant. Doctors and nurses are overworked. Hospitals are struggling with a shortage of beds. Medical oxygen is scarce. Intensive care units are full. And key medication required for treatment are unavailable. The infection has passed the 15 million mark, second only to the United States, while deaths have risen to nearly 179,000, setting off fear and panic. This 65-year-old journalist chronicled his ordeal on Twitter. Moments later, he died while live tweeting for help. Last rites are usually an elaborate affair in India, but now funerals and burials have been reduced to barely a handful of people allowed to attend to minimize the risk of infections from the bodies of COVID-19 patients. Doctors are calling this second wave a tsunami, and as the dead pile up in mortuaries, India's crematoriums and burial grounds are becoming overwhelmed.
TMCಯಿಂದ ನಾವು ಇಲ್ಲಿ ಸಭಾಗೃಹಕ್ಕೆ ತಂದಿದ್ದೀವಿ 9 ಗಂಟೆಯಿಂದ ಹಾಸ್ಪಿಟಲ್ ಬಿಟ್ಟು ಇಲ್ಲಿ 1 ಗಂಟೆ ಆಗಿದೆ ಇನ್ನೂ 2 ಗಂಟೆ 3 ಗಂಟೆ ಬೇಕು ಅಂತ ಹೇಳ್ತಾ ಇದ್ದಾರೆ ಇಲ್ಲಿ ಎರಡೇ ಸಭಾಗೃಹದ ಭಸ್ಮ ಮಾಡೋದು ಎರಡೇ ಸಭಾಗೃಹ ಬರ್ನಿಂಗ್ ಇರೋದು ಎರಡೇ ಇರೋದು ಅಂತ ಹೇಳ್ತಾ ಇದ್ದಾರೆ ನಾವು ಬೆಳಿಗ್ಗೆ ಬಂದು ಇಲ್ಲಿವರೆಗೂ ಕಾಯ್ತಾ ಇದ್ದೀವಿ ಸುಮಾರು 106 ಜನ ಇದ್ದಾರೆ ಇಲ್ಲಿ.
Nearly 15,000 have died in this month alone, but non-stop cremations have cast doubt on India's counting of deaths. Many believe numbers could be higher than official statistics. A video of bodies being cremated near what looked like a platform on a pavement near a cremation ground on the outskirts of the capital has shocked many.
और ये जलती हुई चिताएं इस बात का सबूत हैं कि सरकारी आंकड़ों में और हकीकत में जमीन आसमान का फर्क है.
Things are no different in the capital's largest COVID-19 graveyard. It is filling up by the minute and bodies are being turned away.
अभी ये शुरुआत ही हुई है, लेकिन शुरुआत जो भी हुई है खतरनाक हुई है. पिछली बार ऐसी नहीं हुई थी. पिछली बार धीरे धीरे से शुरुआत हुई थी और 1 महीना लग गया था उसे बढ़ने में. इस बार 4 तारीख से शुरू हुई, सिर्फ 3 दिन के अंदर ही इतनी हाईएस्ट पहुंचता जा रहा है. ये है कि इस बार बहुत तेजी से बढ़ रहा है, ये कहूँगा.
With a sharp spike in cases and a crumbling healthcare system, lockdowns and restrictions have been imposed in many parts of the country, including the capital, Delhi, which is among the worst hit.
हम किसी भी हालत में दिल्ली को उस परिस्थिति में नहीं ले जाना चाहते जहां कॉरिडोर के अंदर पेशेंट्स पड़े हैं, सड़कों पे लोग दम तोड़ रहे हैं. आज सभी परिस्थितियों का जायजा लेने के बाद आपकी सरकार को ये लगता है कि दिल्ली में कुछ दिन के लिए लॉकडाउन लगाना ज़रूरी है.
Following the announcement, tens of thousands of migrant workers could be seen lined up at the bus stations, once again triggering their exodus from the big city. In India, COVID-19 cases had been plummeting since September, and many concluded that the worst was over. Experts say that India failed to prevent a second wave after it lowered its guard when infections fell to a multi-month low in February.
Most of the people believed that the epidemic was over as far as India was concerned. And therefore, I think the forecast of this particular happening did not really register in the policymaker circles.
The country went ahead with elections in 5 states. Large-scale campaigning by various political parties in poll-bound states where all coronavirus-related protocols were flouted are believed to have contributed to the surge. The government's decision to allow Kumbh Mela, one of the world's largest religious gatherings, also sparked outrage. Tens of thousands of maskless Hindu devotees from around the country were seen gathered by the Ganges for a holy dip with no social distancing. The event became a super spreader, with more than 1,700 people infected by the coronavirus. Indian Prime Minister Narendra Modi then called for the festival to be kept symbolic. The latest surge also coincides with the shortage of vaccines in some Indian states. India, a major vaccine manufacturer, has so far administered more than 127 million shots in what is the world's largest inoculation drive, but is facing major supply snags as it works to inoculate nearly 1.4 billion people. The opposition has blamed the government for exporting tens of millions of vaccine doses instead of focusing on immunizations at home. So far, it has exported 64.5 million vaccine doses to other countries, but since March, India has put a hold on all exports to prioritize domestic needs. The country is also trying to bolster oxygen supplies with special Oxygen Express trains for distribution. It has started to divert oxygen supplies from the industry to the health system.
कोरोना के खिलाफ देश आज फिर एक बहुत बड़ी लड़ाई लड़ रहा है। कुछ सप्ताह पहले तक स्थितियां संभली हुई थी और फिर एक कोरोना की दूसरी वेव तूफान बनकर आ गई।
India will open its COVID-19 vaccination drive to all adults starting May 1st. But for one of the world's most populous countries to tide over its second wave, will this be enough?